Schizophrenia. Schizophrenia is a serious mental disorder that affects a person's thinking, perception, and behavior. It is characterized by symptoms such as hallucinations, delusions, speech and thought disorders, as well as apathy and lack of initiative. It is often accompanied by problems with memory and attention concentration. During an exacerbation, schizophrenia can lead to self-harm or dangerous behavior. Early diagnosis and treatment can improve the quality of life for patients. Autism spectrum disorders, ASD. ASD is a group of neurodevelopmental disorders that manifest in early childhood and are characterized by deficits in social interaction and communication, as well as restricted interests and repetitive behavioral patterns. Conditions such as classic autism, Asperger's syndrome, and other related disorders fall under ASD. Individuals with ASD may have difficulties understanding social signals and interacting with others, which can range from mild to significant impairments. Treatment and support are individualized and may include behavioral therapy, development of communication skills, and in some cases, medication intervention. Anxiety disorders. These disorders are a group of mental illnesses characterized by excessive worry and fear. They can interfere with daily life and cause physical symptoms such as increased heart rate and sweating. They include generalized anxiety disorder, panic disorder, phobias, and social anxiety disorder. Treatment usually involves psychotherapy and, if necessary, medication. It is important to consult a specialist for accurate diagnosis and treatment. Depressive disorders. This group of mental illnesses is characterized by prolonged periods of depressed mood and loss of interest in usual activities. Symptoms may include decreased attention concentration, feelings of guilt, lack of hope for the future, thoughts of death or suicide, sleep and appetite disturbances, fatigue. Depression can occur at any age and is more common in women. Effective treatment includes psychotherapy and medication therapy. Bipolar affective disorder, BAD. BAD is a chronic mental illness characterized by significant mood swings, from manic or hypomanic states to depressive episodes. These mood changes can significantly affect behavior, thinking, and the ability to perform daily tasks. Treatment for BAD may include psychopharmacology and psychotherapy, and often requires a comprehensive approach. It is important to note that most people with BAD fully recover between episodes. Sexual and gender disorders. Sexual and gender disorders encompass various conditions related to sexuality and gender identity. They may include gender dysphoria, where a person experiences significant discomfort due to a mismatch between their gender identity and the sex assigned at birth. Also included are various sexual disorders, such as sexual dysfunction and paraphilias. Treatment can range from psychotherapy to hormonal therapy and surgical interventions in the case of gender dysphoria. It is important to approach these issues with understanding and professionalism, considering the individual characteristics of each person. Attention deficit hyperactivity disorder, ADHD. ADHD is a neurobehavioral disorder characterized by difficulties in attention concentration, increased distractibility, and impulsivity. ADHD is most often diagnosed in childhood and can continue into adulthood. Symptoms include excessive mobility, difficulties in performing tasks requiring sedentary behavior, and frequent mood swings. Treatment for ADHD may include medication therapy, psychotherapy, and specialized educational programs. Dissociative disorders. Dissociative disorders are a group of mental illnesses that involve a disruption in the integration of mental functions such as consciousness, memory, identity, and perception of reality. These disorders may include dissociative amnesia, dissociative fugue, depersonalization disorder, and dissociative identity disorder, formerly known as multiple personality disorder. Symptoms can range from mild depersonalization to complete memory loss of important personal events. Treatment usually includes psychotherapy and, in some cases, medication. Obsessive-compulsive disorder, OCD. OCD is a mental illness characterized by the presence of obsessive thoughts and repetitive actions. Obsessive thoughts can cause significant discomfort, and compulsive actions are often performed in an attempt to reduce the anxiety caused by obsessions. Examples of compulsions include excessive hand-washing or checking locked doors. OCD can seriously affect the quality of life and requires a comprehensive treatment approach, including psychotherapy and medication. Post-traumatic stress disorder, PTSD. PTSD is a serious mental condition that arises after experiencing or witnessing traumatic events such as military actions, disasters, or personal tragedies. Symptoms of PTSD include re-experiencing the trauma, avoiding stimuli associated with the trauma, and increased vigilance. This condition can lead to depression, anxiety disorders, and other health problems. Treatment for PTSD usually includes psychotherapy and pharmacotherapy. Somatoform disorders. Somatoform disorders are a group of mental illnesses where physical symptoms, such as pain or fatigue, occur without organic causes. These symptoms can be a reaction to psychological stressors and are often perceived by patients as part of a physical illness, although medical examinations do not reveal any abnormalities. Somatoform disorders can significantly affect the quality of life and require a comprehensive treatment approach, including psychotherapy and pharmacotherapy. Personality disorders. Personality disorders are a group of mental illnesses characterized by persistent and maladaptive patterns of thinking, perceiving, responding, and interacting that cause significant stress or impairments in daily activities. These disorders typically manifest in adolescence and may be associated with genetic and environmental factors, such as experienced stress or trauma. Treatment includes psychotherapy and, in some cases, medications to alleviate symptoms. Eating disorders. Eating disorders are a group of mental illnesses characterized by an unhealthy relationship with food and one's own body. They include anorexia, bulimia, and binge eating disorder, as well as nonspecific disorders such as compulsive overeating and night eating syndrome. These disorders can lead to serious physical and psychological complications, including nutritional and metabolic disturbances. Treatment may include psychotherapy, medication, and dietary programs. Substance-related disorders. Substance-related disorders cover a wide range of problems arising from the abuse of substances such as alcohol and they can cause physiological dependence, psychological changes, and social problems. Symptoms vary from intoxication to withdrawal syndrome and can include mood changes, cognitive impairments, and physical symptoms. Treatment depends on the type of substance and the degree of the disorder and may include detoxification, rehabilitation, and psychotherapy. Neuroses. The term neuroses was previously used to describe a group of mental disorders arising from psychological stress and characterized by the absence of qualitative changes in mental activity. Symptoms may include anxiety, phobias, depression, obsessive thoughts, and compulsive actions. Neuroses do not involve a loss of reality, and people usually recognize their problems and can control their behavior. In modern medical practice, the term neurosis is used less frequently, and many conditions previously classified as neuroses are now described with more specific diagnoses. Yes. I'm the guy from the video. Thank you very much for watching. I will be glad if you like and leave a comment on what topic you want to talk about in the next video. Also, don't forget to watch our other videos. See you again!